and we're using medications that are not so toxic and are much better at targeting specific symptoms, we're now able to do hip replacements in a much less invasive way. So I always try to make it clear to folks what the surgical treatment involves, or as best I can. And then we decide together when the best time is to do this. And what's been really fun with hip arthritis as well, or the treatment of hip arthritis, is we're not setting people up for these super invasive, multiple nights in the hospital type procedures that we used to do. It's been really fun to work through this past 2 decades. Hip replacement for arthritis has been around for decades. And it's really great how our implants have evolved and become much, much better, and they will continue to evolve. But what's been really, really interesting for me as a surgeon is to be a part of the evolution of the surgical technique in doing these surgical procedures for hip arthritis and making them less and less invasive. For certain people, particularly older folks, they need the support of a hospital to get them through these types of invasive procedures like a hip replacement for arthritis. But for a lot of people who have hip arthritis, they don't need to be in the big hospital. And because we're not doing things as invasively as we used to do, and we're using medications that are not so toxic and are much better at targeting specific symptoms, we're now able to do hip replacements in a much less invasive way in a setting like our surgery center that has many less patients here who are much less sick than you would otherwise be exposed to. So coming into an outpatient surgical center and having a hip replacement and going home the day of that procedure, that's just happened over the past 5 years. And that's been really, really fun to be a part of, because we don't want to expose people to any more risks or pain or length of recovery than we need to. We don't need to do that as much as we used to have to do. And we'll continue to get better at that. We're in a time in history where the surgical treatment of hip arthritis is much less onerous than it used to be. That's been a massive part of my work for the past 20 years, and extremely fun and gratifying and fulfilling as an area of work.